Good evening all. Today is World Diabetes Day, and this year World Diabetes Day theme is the nurse and diabetes. This will also shed light on the COVID-19 pandemic, which led to long working hours for many healthcare professionals, especially nurses. And we should acknowledge that nurses play a huge part in helping people with diabetes. And today is the day when we are worshipping Ma Jagadamba, who is nursing all of us. Devi Prapannarti Hare Prasida, Prasida Mata Jagato Akhilasya, Prasida Vishweshwari Pahi Vishwam, Tvamishwari Devi Characharasya. My prayers to Mother, Ma Jagat-Janani, please nurse all of your children with education by which they can nurse themselves. Dear diabetes patients, please follow A, B, C, D, E, F, G, H, I control rules, and so that you can prevent macrovascular complications like heart attack, stroke, and microvascular complications like kidney problems, eye problem, neuropathy. So what is that A, B, C, D, E, F, G, H, I rules? A means control your A1C, that is HbA1c. Apart from that, you should also control your fasting plasma glucose and postprandial glucose value. There is another important A in this picture, that is ACR, urine ACR. That denotes how much kidney is involved by your diabetes. So check urine albumin creatinine ratio as per your doctor's advice and monitor that so that your kidney stay healthy. Next is B. B is again very important issue, that means blood pressure control. And for blood pressure control, most societies generally recommends to keep blood pressure less than 130 by 80 millimeter of mercury. At least as per the ADA, American Diabetes Association's guideline, and our Indian guideline, at least we should keep our blood pressure below 140 by 90 millimeter of mercury. So check your blood pressure regularly and visit your doctors and have appropriate management for your blood pressure. Next is C, that means cholesterol management. So that is a very often a neglected issue by the patients themselves, because most of the patients generally tell us that my cholesterol level is normal, so why I will take cholesterol lowering medications. But it is important to note that a diabetic patient cholesterol value, if it is X, and if a non-diabetic patient's cholesterol value is also X, the diabetic patient's cholesterol value X is much more detrimental. So we have to make our diabetic patient's cholesterol value much lower side. So we have to reduce diabetic patient's cholesterol value. So it is very important, generally recommended by all global guidelines and Indian guideline, that if your age is 40 years and you are diabetic, you have to take one cholesterol lowering medications. The dose will be decided as per the bad cholesterol value and your doctor's decision, but you have to take one cholesterol lowering medications if your age is more than 40 and you are diabetic. So this is very important, and this drug generally we prescribe different statins. So apart from C, next is D, and D is very obvious, that is diet control. So contact your doctors and dietitians to have optimum dietary advices. Specifically, calculate your calorie calculate your carbohydrate, protein and fat intake and monitor it and follow your dietitian's advice. E is extremely important for diabetes patients, and that is exercise. So exercise is very important. Again, this is very much patient specific. Generally, we recommend for all practical purposes at least 30-minute brisk walking along with 15-minute muscle training, resistance exercise, and that is not generally recommended for all every day in a week, at least alternate day or 2 to 3 days in a week. But for young individual, they can also practice resistance exercise every day. And apart from that, we also should promote yoga, because yoga reduces stress and it has an immense benefit in cardiovascular metabolic health. So this E is very important. That means you have to do proper exercises. Next is F, and F means you have to check your food, because diabetic foot is a very dreadful complications. So you have to visit your doctor, and your doctor will check your foot so that there is no complications happening. So foot examination is very important. Then another F, that means fundoscopy. What is that? You have to check your retina. Any diabetes related complications arise or not, we have to check. And that is why all the guidelines related to diabetes generally recommends at least once yearly visit to ophthalmologist to check your retina. So retina checkup is very important. Next is follow-up reconciliation. That means check your anti-diabetes medicines and other medicines, because they may have some adverse drug-drug interactions. Because apart from diabetes, you may have other diseases, and for that you are taking some medicines. So whether they have some adverse drug-drug interactions, you have to check. And otherwise, you have to also check the suitability of different medicines you are on, and with respect to your health related factors like your kidney condition, your liver conditions, etc. So these three domains of F. Next we go to G, and G for Google. So say no to it. Generally, Google doctor is dangerous for patient, because we don't know which information is correct, how to interpret different results, and there are many wrong informations that may present in Google, and that may create some confusion. So please say no to Google doctor. Next is H, and that means hypoglycemia awareness. Be aware of the symptoms which suggest your sugar is falling down. And another important issue is, if you are failing to recognize the symptoms of hypoglycemia, that means sugar fall, that is also dangerous. So you contact your doctors if something happens like that, hypoglycemic unawareness. So this is very important, and H is this hypoglycemia awareness. And last but not least is I. That means inertia to insulin. Insulin is friend to us, friend to diabetic patients. Insulin is not enemy. So you have to accept that if you have diabetes, and you should talk with your doctor regarding insulins. And there are many wrong conception on insulin. So you have to clear it out. So insulin fear may be detrimental for your diabetes management. So you should gather good amount of knowledge regarding insulin, because timely initiation of insulin may prevent insulin initiation prevent different diabetes related complications. So again, you have to address this inertia to insulin. Do not fear about insulin. So this is about this A, B, C, D, E, F, G, H, I, what I had explained. So again, I am wishing you a happy Deepavali, happy Diwali and Shubho Kali Puja, and hope my diabetic patients, all the diabetes patients remain healthy. Thank you. Bye-bye.